Hey, so a really important aspect is where do we get all of the equipment from? Where do we source it from? And there's two main places, and there's quite a few different things that we need to go through and, have a bit of a look at what I do. And it may not be the best, but it's definitely one way that you can do it and that I typically recommend as well, because it's a cost-effective, safe way to go about it all. Now, initially, Brand Surgical, a Queensland-based group, is the main place that I get most of all of my clinical needs and definitely my surgical needs as well. Now, the group is Wesley Pharmacy, and some people that are Queensland-based may be aware of Brands and Wesley Pharmacy because they are quite a big group. Do have a bit of a look. Definitely, they're really hard to log into and it's a really unfriendly website. But give them a call, set up an account and see what you can do that way. Now, the other one, and only for one thing, which is our bicarbonate, the Vital Medical Supplies is where I get this from, and it's typically in a larger quantity than typical. So have a bit of a look at them, set up an account. Similarly, much more user-friendly website that we're looking at. Now, of course, the most important thing is dextrose in 5%. I typically undertake or get these in the free flex bags, a 200 ml bag. They're around that $4, per bag, and for you guys, I buy in bulk so that I can provide them during our courses. Now, when you're using the brand's website, there's these codes here that are really important, and you can just put that code straight in, and it'll bring up this that I offer, or otherwise try a few different things to make it come up most appropriately. It is quite a difficult website, but once you get your head around it, you're pretty well right there. Other options are available, such as just a 50 ml vial. Sourcing those can be quite difficult, and there's very few places in Australia that have them consistently, and that's why I go with this one. 3 ml syringes, you can use 5 ml or 10 ml. I typically find that a 3 ml is great because remember, we're only doing half a milliliter, so where it's actually showing me exactly how much I'm providing is a really nice way to go. Again, we've got our code. They come in boxes of 100, as you likely know from other syringes, and they're about that $13 per box of 100. Similar, very small needles are what we're using. A 30 gauge, I typically like these ones, 13 millimeters long, $5.70 per box, not a huge expense, and they're really quite good. They stay sharp over several uses as required. Of course, not wanting to change them between syringes, but definitely for that 4, 5 or 6 per 3 ml syringe, there are definitely no problems that way. Now we need to draw up, and so an 18 gauge sharp drawing up needle is sort of what we're looking at there. Again, you're only going to use this once per draw up of injectables, and so this is where this comes in handy as well. Again, quite cost effective as far as needles and products go. Now, this is where I do spend a little bit more money, because I think these sharps containers, that we're looking at here, they're one of the better options. They are that 5.1 litre. They're a next gen because they've got a little bit of a flap on there, so you can put your syringes in there. And for myself, that's using and undertaking quite a lot of injections and other procedures with sharps. I just find that this is a really nice way to go. They can come with a bracket, and for myself, I actually hang that over the end of my treatment table so that I can make sure, yep, I've got that available right at the point of injecting. So again, maybe a little bit more expensive than our $3 or $4, $5 single sort of ones, but you're definitely going to get the use out of this one that is definitely worth using. Now, before we undertake our injections, as you're aware, we do use a bit of an alcohol prep pad. These are a very standard one, at $4 a box of 200. Pretty safe to say that's a good way to go. If you're using other ones, be aware, and there's definitely chlorhexidine ones, which, to me, in my experience, there's definitely more likelihood of reaction to chlorhexidine than what there is alcohol. But of course, we're checking with our patients with regards to that. Standard blueies, your clinics will probably have them, but just to give you a bit of an idea, $47 per carton of 250. They're pretty standard. They're always going to be quite expensive, but I do typically like to have one of these underneath the patient's leg before undertaking. One where I've got all my injectables to keep them clean, and then sometimes I'll put one on the floor as well, or typically I do, because there's going to be, as we're injecting before we're actually piercing the skin, there's going to be a little bit of fluid that comes off as well. Gloves, everyone's different with their gloves. I really appreciate that. My favorite are the glove-ons, and they are a bit more of an expensive glove, but for me, they are fantastic. To give you a bit of an idea through brands, they are $15.87 per box of 200. So maybe a little bit more expensive, but I think you pay for what you get here, definitely. Now, the other one that I alluded to earlier, this is the Vital medical code and the medical sort of product, and that's that sodium bicarbonate, 8.4% in solution. These come in a box of 10, and you can see there that $120 sort of mark there for 10 vials. Now, for each of that 250 mils of 5% glucose, you're only putting in about 1.2, 1.3 mils of the sodium bicarb. And so this is where, and with a lot of these other things, I'm happy to start providing some of this as the one vial, because they're going to obviously, last quite a while, and make sure that it's undertaken in a safe way when you're redrawing. But there's these options that you've got available as well. They're $120, but for what we're sort of charging for some of these options, definitely a good way. Now, you don't have to use sodium bicarbonate, but it definitely gets rid of some of that sting that the patients can experience and makes it generally more comfortable overall. So we'll talk a bit more about this later too. Now, there are a few other potential requirements that you need. I always use clinical glasses. I use Hoagies, which is a really commonly used surgical glasses or goggles. They're quite nice. They're anti-fog. They're a really good way to go. If I'm not wearing my scrubs, I wear one of the plastic gowns. I'm sure you've already got those in clinics. And after all of my injections, I use Hyperfix. Now, as we talk about, if not already you've seen, but you will see, I use a lot of taping and Hyperfix because there's not too much bleeding, and Hyperfix is really giving that neural feedback as well because it's got a bit of stretch, but any medical tape could do. Yes, if we do have patients that are bleeding a little bit more, you could use Cutiplast as well. Each of those, you can get through different groups. Of course, the glasses, they're from hoagies.com, but the rest, through our typical suppliers as well. But hopefully that's given you a bit of information on sourcing equipment for LiftDoc Prolotherapy. Cheers.